so here we have 30-year-old Andy. Chief complaint is epistaxis. So first things first, he's still bleeding. So what I'm going to get you to do is I'm going to get you to lean forward and pinch the soft bits of your nose, just like that. Just below the bony bits. And that's alright, and that should stop compressing the bleeding.
Okay.
So vital signs have been done, and bleeding has been tamponated at least for the 15 minutes. I'm going to take note of when the compression has started. Alright, so tell me a little bit about what was happening. What were you doing when this started?
I was walking around the house and I blew my nose and it started bleeding.
Oh, okay. Has this happened before?
Yeah, it happens quite often in allergy season.
Okay, yeah, that makes sense. Alright, and is this different to what you've had before?
It just lasted a little bit longer.
Okay, and what's a little bit longer?
It usually only lasts for about a few minutes, but this was about 15 minutes.
Okay, alright, and were you compressing it during those 15 minutes, or were you just letting it?
No, I was just using this.
Okay, alright, and is that all the blood that you've lost on that rag there?
Yeah,
Alright.
pretty much.
Okay, that looks like about a couple teaspoons worth of blood.
Yep.
And his vital signs are within normal limits, which indicates that he's hemodynamically stable. And 15 minutes is up. Alright, if you want to stop compressing and sit up, let's see if it... You think it's stopped?
I think it has, yeah.
Yeah? Can't feel it running down the back of your nose?
No.
Okay, alright, and it looks like it stopped as well. And because it was mild and stopped with 15 minutes of compression, it's indicative that it's an anterior bleed, which is really common in allergy season, especially if you're prone to sinus irritation like that, that little capillaries, little blood vessels in your nose just start bleeding. And it's nothing too serious, especially if it's now stopped and not running down the back of your throat.
Yeah.
So this is quite normal for you?
Yeah.
Happens regularly?
Normal, yeah.
Okay. Have you been to a doctor before about it?
No.
No, you haven't had anything cauterized?
No.
Okay. That might be something to potentially think about in the future.
Mm.
And you're not on any blood thinning medication?
No.
No? A history of high blood pressure? No? Normally fit and well?
Yeah.
No daily medications?
No.
Sweet. So it's good to kind of get a background to see if there are any risks for a posterior nosebleed or potentially it getting worse and starting up again. So just in case that this compression didn't work, or if it was worse, you could also consider using an ice pack on the back of the neck or ice cubes on the nose as well to kind of compress the capillaries in that area, or to compress all of the cranial vessels due to the cold. If after 15 minutes of compression the epistaxis continued, you could consider some IE and adrenaline. Have you had to use that before? Anything going on your nose? Okay. So what that would have done is it would have just constricted the local blood vessels around there to kind of stop the bleeding, like ice, but it's actually on what's bleeding. 0.2 milligrams of adrenaline in a total of 10 mils of saline. That's how you would prepare it. You would administer 2 mils of saline in each bleeding nostril with a little iron diffuser. Before administering that, you would get the patient to blow their nose, administer the 2 mils, and then compress the soft bits and lean forward for another 15 minutes. If that didn't work, you could, of course, reassess, give another dose of iron and adrenaline. If that didn't work and it was still bleeding, you would then go for an ETT or a rapid rhino from an ICP or an ECP. Another thing to consider would be calling an ICP for a gram of TXA as well. However, because it's stopped now, I'm happy with leaving you at home. Does that sound okay?
Yeah, sounds okay.
Yeah, are there any other people around in the house at the moment?
No, it's just me.
Okay, that's alright. So what I have here is a little pamphlet that's for you to read.
Oh, okay,
so what
you.
It just kind of... for you to read.
Yeah.
What it just covers is things to look out for, so ways to prevent it, so no blowing your nose, no picking your nose, trying to avoid hot drinks as well.
Yep.
Because it kind of does the opposite of ice and adrenaline, as it can make those blood vessels a little bit more relaxed and open and cause the bleeding again. If compressing it for 15 minutes and leaning forward doesn't fix it, call us back again, okay? If it's out of control, if you're worried, you can always call us back. And I do recommend that you go see your GP within the next few hours, potentially, just to get it cauterized. Alright. And just because Andy, we're going to leave you at home, if it's alright, I'll just run through our non-transport checklist.
Yep.
So could I get you to just stand up and take a few steps and tell me if you feel dizzy at all or anything like that?
No, I feel okay.
No, that's fine. You can sit back down.
Thank you.
And we'll run another full set of vitals, and if they're within normal limits, that's another tick in being able to leave him at home. He's been fully assessed. Everything is normal. And so you haven't had any head injuries recently? It was just you just blowing your nose and then it started?
Yeah.
Okay, alright. And normal mobilisation, and there's no caregivers around or anyone that could keep an eye on him, but you understand when to call further advice? When to call for help?
Yep.
Okay.
Yeah, when it gets too out of control, keeps bleeding too much.
Yeah, and if you're not sure if you call us or not, there's the Healthline number on there as well, and they can do an over the phone assessment on you and see if they think that you need an ambulance.
Okay.
Yep.
Great. Thank you.